Hey everyone, coming up I'll be discussing a few points about how to optimize the medication you may currently take for depression and anxiety and how you can improve outcomes with these medications if you feel they aren't quite doing the trick. Stick around. I'm SWOFFORD. I'm a psychiatric nurse practitioner, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about mental health treatment from the provider's perspective. If this content interests you, please click on the subscribe button and that little bell, which will notify you when we release new videos. As a psychiatric nurse practitioner, I prescribe psychiatric medications for individual clients day in and day out and have been doing so for 11 years. I've learned a lot about how to maximize people's current medications, and I would love to share a few ideas with you. But a little bit of fine print here. Most of these concepts I'll be discussing are ideas of what to talk to your doctor about to see if it can help in your case, and aren't things you should be doing on your own without medical supervision. This video is not intended to replace the care you are getting from your prescriber, who knows you and your individual case because they have done a proper psychiatric assessment of your symptoms. All right, same page? Cool. Okay, let's jump into a few recommendations on how to get more out of your psychiatric medications if what you are doing right now isn't quite enough. Keep in mind too that psychiatric medications are not going to cover your symptoms 100%. In fact, I often tell my clients that medications should be supporting you at about 30% capacity, with therapy, diet, exercise, and lifestyle changes making up the rest. There are a zillion things that can be said about lifestyle changes to support mental health. Here, I'll be discussing ideas that are very specific to optimizing your psychiatric medication regimen, which of course includes a healthy lifestyle, but I will not be launching into that in this particular video. Okay. First idea is to give your medications more time. Antidepressants and other medications for depression, bipolar disorder, anxiety disorders such as social anxiety disorder, generalized anxiety disorder, PTSD, and OCD typically take 4 to 8 weeks to become fully effective. There are some in psychiatry who suggest changing medications if they're not effective after 2 weeks, and I do agree with that concept if you are on a decent dose and you are seeing absolutely zero response whatsoever. However, medications are often started really low to minimize side effects, and you may not see an effect in 2 weeks if the dose isn't moved beyond that. Medications for ADHD start to work pretty quickly, much earlier than a couple weeks, but you still need time to adjust and learn what it looks like in your life to have it treated. Time is also the key ingredient when it comes to side effects, especially ones that are felt right away, like nausea, sleepiness, or restlessness, and those usually go away within a week or two. Often the best advice with side effects is to wait it out, but of course you're the actual human being taking the medication, and only you can make the full call or the final call about whether a side effect is something you can wait to resolve or not. Okay, number 2, change your dose. People respond to medications differently, and you may benefit from a different dose of medication than what is usually prescribed. Ask your provider whether this is an option for you. An increase might bring more impact, a decrease might lessen side effects. But do not change your dose on your own, as several factors are involved in determining the proper dose. If you have found that sweet spot with a nice balance between symptom management and side effects, good for you. Don't touch that dose. All right, number 3, switch antidepressants or try a different class of antidepressants. For 50% of people, the first antidepressant tried is not effective. You may need to try several before you find one that works for you, and that's really common. Don't get discouraged. These medications are different enough from one another that switching it up might make a huge difference. Trying a handful of the same medication, however, is not usually helpful. Once you've tried 2 or so of one class, it's probably time to try a different type of antidepressant. Okay, let's play that out. Let's say you, for example, been on 2 SSRIs or serotonin reuptake inhibitors. Those increase serotonin and are usually the first prescribed. If you've already tried 2, it's time to try a brand name SSRI, or maybe try a different class, such as an SNRI or a serotonin and norepinephrine reuptake inhibitor, which increase both serotonin and norepinephrine, or tricyclic antidepressants, TCAs. Those increase serotonin in a different way than SSRIs, or bupropion, which stands in its own class and targets dopamine and norepinephrine, not serotonin. Okay, number 4, add another type of antidepressant. If you've already tried changing antidepressants and you're finding a pretty good benefit from one antidepressant but need more help, your provider may prescribe 2 different classes of antidepressants at the same time in order to affect a wider range of neurotransmitters linked to mood, which can create a more well-rounded treatment of your condition. Okay, next one would be to add another type of psychiatric medication as an adjunct to your antidepressant. Your provider may prescribe a medication that's generally used for other mental and physical health problems along with the antidepressant. This approach, known as augmentation, wouldn't be another antidepressant, but would be more like an antipsychotic, a mood stabilizer, a blood pressure medication, anti-anxiety medications, thyroid hormones, or other supplements. Okay, my next idea is consider pharmacogenetic testing. These tests check for specific genes that indicate how well your body can process or metabolize a specific medication or how your depression might respond to that medication based on genetic and genomic factors. Pharmacogenetic tests are not a holy grail. They are not a sure way to show if a medication will work for you. And there are many different reasons that people respond the way they do to medications. But these tests can provide important clues for treatment, particularly for people who have had many side effects or have had poor results with a lot of different medications. Next concept is to diagnose and treat other conditions if they apply. Maybe your depression or anxiety is actually very well treated, but it feels like you continue to have symptoms that are affecting your life in a negative way. Have you considered that maybe you have an additional condition? Some people are resistant to being on more than one psychiatric medication. But if you have more than one disorder, you should treat them, just as you would treat concurrent medical disorders like high blood pressure, diabetes, and high cholesterol. This is no different than if you have depression or anxiety and you also have ADHD, a sleep disorder, or a very specific anxiety disorder such as PTSD or OCD. Next tip is ditch the benzodiazepines. Some people with anxiety end up on a daily regimen of benzodiazepines to manage their anxiety disorder. These medications of course have their place in anxiety treatment, which is to target extreme anxiety that does not occur daily, like a panic attack. These medications make you not care that you're anxious, just like an opiate makes you not care that you're in pain. That's really great for acute anxiety, but it's not actually treatment of an anxiety disorder. They work great as a rescue medication, but if you're relying on them daily, you are not on the right medication for your anxiety, and it can get dangerous, lead to more depression and anxiety, lead to falls and other medical conditions, and lead to needing more and more of the benzodiazepine over time, because people do develop chemical tolerance with benzodiazepines. Add therapy. If you're on psychiatric medications and not in therapy and you feel like you need more help with your symptoms, you should absolutely start therapy. I have so much more that I could and would say about this, but for the sake of this specific video around your medication regimen, I'll just say this. Evidence-based research shows us that outcomes in mental health are best when psychiatric medication is combined with psychotherapy, when compared to either of these treatment options used alone. So do not miss out on this very key strategy to improve your outcomes with your psychiatric medications. Okay guys, that is it for my tips on optimizing your psychiatric medication regimen. I hope this information is helpful to you in being an informed consumer with the medications you take and in the conversations you have with your prescribing provider. Remember, these tips are not meant to give you medical advice for your specific care, just to provide ideas on how and what to talk with your medical provider about in terms of your psychiatric medications. If you're struggling with mental health symptoms and you feel like you're just not getting better, reach out. There are so many people ready and wanting to help you. There are treatments available. If you're in the Portland, Oregon or Vancouver, Washington area, please give us a call here at TMS Northwest. We would love to help and guide you. Thank you.